Hi, everyone. My name is Mrs. DeAndrea, and I'm going to be talking to you about puberty. So I'm sure a lot of you have heard the word puberty before, but just aren't too sure what it actually means. So puberty is the time when your body goes from being a kid to an adult. And so during puberty, you're going to experience physical, emotional, and social changes. And these changes can occur between the ages of 9 to 19 years in males and 8 to 17 years in females. So let's first talk about the physical changes that happen during puberty. So I know Mr. Jaladinov and Ms. Ruiz introduced you all to the male and female reproductive organs. So in this lesson, I'm going to further explain what happens to your reproductive organs and overall bodies when undergoing puberty. So a key thing that I want you to remember and think about throughout the lesson is that everyone is different and unique, and the changes that happen can vary from person to person. So the process of puberty is going to look and feel very different for everyone. And there's no right, normal, or ideal way to experience puberty and the changes that it brings. So first, let's go ahead and look at the physical changes in males. So in males, there's going to be an increase in body, facial, pubic, and underarm hair. There are going to be some voice changes like a voice deepening and even some cracking. And your body's going to grow. So there's going to be an overall growth of your height, and males are going to develop more muscle mass. And of course, your sexual organs are going to continue to grow and develop. And so for males, the penis and the testes are going to grow larger. Something that happens during puberty is there is an increase in oil production. So that can lead to acne, which again is very common and very normal. And there is going to be a development of some new sweat glands, and that will result in an increase in sweat production, therefore resulting in a more noticeable body odor. So all these physical changes are pretty general, and again, they're going to look and be different for everybody. Some males develop a lot of body hair, some not as much, some a little bit. There are a lot of voice changes. The voice gets very deep, it doesn't. So just keep that in mind throughout this lesson. So, and the same thing with looking at physical changes in females. This is going to vary greatly from person to person. But again, some general things that are going to happen are there are going to be an increase in pubic and underarm hair growth. All similar to, just like males, there's going to be an increase in oil production, and the new sweat glands are going to be developing. So there's going to be potential for acne and more noticeable body odor. And again, you're growing, so there is going to be an overall body growth, going to get taller. And for females, there is going to be an increase in body fat, and as well as your hips will begin to widen. And that's just preparing your body for potential of being able to have a baby, get pregnant. So, and specifically with female sex organs, breasts are going to develop, and a significant change that happens for females during puberty is the start of menstruation, or also known as your period. So I'm going to go ahead and cover that more in future slides. So hang tight for more instruction on what menstruation is. All right, so with the physical changes that your body is going through, they are triggered by hormonal changes, and these hormonal changes can lead to emotional changes. So what is going on in your body is the brain is signaling your body to begin to produce hormones, and these hormones go throughout your body and trigger the change in development that occurs during puberty. So these hormones can lead to you experiencing emotional changes like mood swings, experiencing feelings more intensely, increased stress, anxiety, and depression, feeling more self-aware, and even more self-conscious. So a lot of these emotional changes can be very overwhelming. So it's really important to be kind to yourself and to reach out to a trusted adult, like a parent or teacher, school nurse, coach, doctor, if you're really finding that you're struggling with some of these changes. So again, puberty, it's the transition from being a kid to an adult, and you're going through physical changes, you're going through emotional changes, and you're just getting older. So inevitably, there's going to be some social changes that you would experience during puberty. So some social changes that you could experience include changes with friends or different friend groups, maybe more peer pressure. Um, you may find yourself being more interested in having a romantic relationship and just being more aware of, sexual attractions to people. And just with growing up and getting older, you're going to find an increase in independence and increased responsibilities. So that also can tie into the emotional changes you're going on with, increased feelings of stress and anxiety when you're feeling some changes with friend groups and you're feeling, more pressure at school or with responsibilities you have. So it's just really important that we remember that all these changes going on can feel really uncomfortable, and because they can feel really challenging or scary or be really intimidating, and just remember it's all completely normal, and that these changes can also lead to really new exciting things like new opportunities, new relationships, friendships, and even new experiences that in the end are going to help you grow and develop into the person that you want to be. All right, so if you remember in the slide when I was talking about physical changes in females, I ended on discussing briefly menstruation or your period. So when a female begins to menstruate or she gets her period, it means that her body is ready for the potential of getting pregnant and having a baby. So this video is a short one, but it's really effective and really breaking down what physically happens to your body and what type of symptoms you could expect with your period. And again, it really emphasizes that this is going to look and feel and be different for everyone. So let's go ahead and jump into the video.
Okay, so let's see. We have a first aid kit, acne cream, hot water bottle, sleeping mask, ice cream and tuna cans, check.
Jane, what's going on? Are you preparing yourself for the end of the world?
What? No, I'm getting myself ready. For that time of the month.
One of the physical changes of puberty that a person with a uterus will experience is getting their period as part of what's called the menstrual cycle. This normally happens between the ages of 8 and 13, and for some people, even older. Everyone goes through puberty at the time that's right for their body. Once a person reaches puberty, those with a uterus prepare for the possibility of eventually making a baby. Once a month, one of your 2 ovaries releases a small egg or ovum into the fallopian tubes. The uterus then begins to grow an extra lining in case the egg becomes fertilized with a sperm. When no sperm is there to meet the egg continues to travel down the fallopian tubes and signifies to the uterus that the person is not pregnant and the extra lining isn't necessary. The uterus then expels the lining, which looks like blood, through the vagina. This is called menstruation, or getting your period. Menstruation generally occurs every 21 to 35 days and lasts from 2 to 7 days. When people first start menstruating, they may get them more or less frequently. Some people refer to their period in code, calling it that time of the month, code red, or Shark Week. The menstrual fluid may be heavy, light, or somewhere in between. PMS stands for premenstrual syndrome, and is the term used to describe the physical and emotional symptoms that many people experience 1 to 2 weeks before starting their period each month. During PMS, you might experience acne, bloating, feeling tired, backache, breast soreness, headaches, constipation, diarrhea, food craving, depression, moodiness, difficulty concentrating, trouble handling stress, or difficulty sleeping. Boy, that's a long list. But don't worry. Not everyone experiences all of these, and most of these symptoms usually disappear when your period begins. During their period, a person might experience menstrual cramps. They may start 1 to 2 days prior to your period and can last 2 to 4 days. Menstrual cramps are the result of uterine contractions, when the uterus tightens and relaxes in order to release and shed its lining. These contractions can cause jabbing or cramp-like pain in the lower abdomen and lower back regions. Over-the-counter medicine and heating pads can reduce the discomfort caused by cramps. Always ask a parent or guardian before taking any medicine. While some people experience PMS and cramps, others do not. Either way is normal. Starting menstruation is a normal part of puberty and an important milestone in your transition to adulthood. Until next.
All right. Well, I hope you enjoyed that video on menstruation and just what to expect. I really enjoyed, again, how they highlighted that this is going to be different for everyone and just really broke it down in a way that I hope you all enjoyed as well. So
Okay, so let's see.
Sorry about that. So my lesson on puberty is coming to a close, but before I leave you all, I just want you to remember that everyone is different and unique, and the changes that are happening during puberty can happen at different times and vary from person to person. So the process of puberty is going to look and feel differently for everyone. So I just hope you all remember to be kind to and patient to yourself and be kind to one another. So, all right, thank you all. I hope you have a wonderful day.